Hello everyone, welcome to Pediatrics by Dr. Anand. Is my voice audible to everyone? Please put a message in the comment section. Thank you. What's up? How's everything going? Let's start the class. Let's go start the mind-blowing, amazing class. I have just to see whether my voice is audible or not audible to everyone. Hello everyone, is my voice coming? Put a thumbs up. Oh, it's coming. My $1 million voice is coming. Hello Osama. Hello Sukhbir Singh. Hello Panchal. Hello Suman. Hello Dr. MD. Hello Dr. MD Jasimuddin Khan. And hello Suman. What's up? What's up? What's up? What's happening? Okay, nothing happening. My name is Dr. Anand. This is the beautiful Unacademy NEET PG platform. Let's start the beautiful class. Today's topic of choice is TBM and some amazing MCQs I'll be asking you of the milestones, because many people are saying that some milestones can we please quickly revise it? Yes. In this Unacademy beautiful platform, I hope you guys have given the last week's amazing, super amazing test. And now I'm going to share within 1 or 2 days, I'll be sharing you with this week's amazing test series. All India mock test just now happened. I hope you got a good rank in the All India mock test. Okay. Beautifully in the Unacademy, first of all, we had this amazing 20% off and so many people had got the pack. Now the long offer is no longer available. Also at the same time in the Unacademy, we have plus subscription, iconic subscription, light subscription and MBBS first year subscription. So many people, amazing people are taking this beautiful subscriptions. I hope you all are a part of it. Unacademy is the most beautiful platform. Why? Because we are together, we are connected. That's why. Okay. Hello everyone. Is my voice is audible? Yes or no? Gunjan says, sir, I went for Zumba motivated by you. Good. I like it. I feel happy. I feel comfortable with people who are very, fitness freak, diet conscious, as well as inspiring by nature. People who are fat, stay away. Just kidding. Okay, at the same time in the Unacademy, we have this MBBS first year prof, batches we have already started. This beautiful, we have this 3 months pack, 6 months packs, and 12 months pack with the beautiful price, with the beautiful final price. So it was there in the April month. I hope you guys have taken. It's beautiful. Also at the same time, for the light-hearted students, we have this beautiful light pack for which basically has the previous year question papers, as well as amazing grant test for the NEET PG, INI, CT, and FMG grant series. Also at the same time in the beautiful Unacademy platform, we have plus subscription and something known as iconic subscription. In the plus subscription, you get amazing access to the live and recorded classes. The educators are really amazing. Dr. Anand is one of them. And also at the same time, we have this amazing live test and quizzes, which is really good. At the same time, we have this, you can watch me on your iOS, laptop, any device. It's amazing. Okay. Perfect. Right. So, Sukhbir Singh, most common congenital heart disease in pregnancy. Bro, how will I know? Like Sukhbir Singh is asking most common congenital heart disease in pregnancy. In pregnancy, dear, I'm really sorry. Pregnancy wala part to we have to ask the obs and gynae, no? If you can ask me most common congenital heart in general in cardiology, I can tell you. In infant of diabetic mother, I can tell you. In babies, I can tell you. But in pregnancy for the mother, you're asking for the baby, right? I don't know how. Please let me know again. What are you asking? In the iconic subscription, you have the Unacademy platform and the Prep Ladder subscription. All the treasure hunts, questions, video lectures, live batches, everything is there in the iconic subscription. The NEET PG previous year question bank is something we must solve of all the subjects. So go to the Unacademy app, go to self study, go to practice, and go to subject. You will find the previous year question papers. They are free. Go enjoy and finish them. You will get a notification automatically every day with the auto daily practice papers, which are important for us to solve. You'll get a notification because I make a link for that. The batch on the frequently forgotten topics and emergency medicine is already starting on May 4th for 10 days with the beautiful faculties we have, which will be helpful for your exams. Okay, let's start the amazing segment. Exactly. Okay. ठीक है. Okay, let's start the class. ठीक है, पानी बस पानी बाद में पीता हूँ. हाँ जी. Okay. Yes. Before starting any amazing segment, we always have a motivating quote. And today's motivating quote is the one we saw it recently also. When I hear somebody say life is hard, when I hear somebody saying life is hard, I am always tempted to ask, compared to what? Are you saying life is hard compared to a beggar? Are you saying life is hard compared to a rich people? Are you saying life is hard comparing to someone who has a BMW? Or what? How are you saying the life is hard? It is all the people's perception, how you perceive your life, how you want to compare it. I was reading this recent article. The person who only has a bicycle, he dreams, I wish I had a scooter. Someone having a scooter says, I wish I had a four-wheeler car. Someone who has a four-wheeler car says, I wish I have a BMW. It's quite classy. So people having BMW, they think I should have one helicopter, that's it, and one small chartered plane, nothing else I want. So the desires will never get over, the wishes will never get over. So we all say life is hard, life is hard, life is hard. But the problem is, like, hard compared to what? From what are you comparing? Millions of us don't even have, millions of people don't have what you have, so be thankful to what you have in life is really very important. Okay, so that's a beautiful part of this class, and also very beautiful quote from Lord Buddha, one of my favorite. Life is short. Spend it with people who make you laugh and feel loved. Such a beautiful quote. Life is short. Life is short. So if anyone of you who are in hopeless relationships, any one of you who are stuck in bad friendship, bad relationships, or bad surroundings and bad aura, don't wait for the right time to come and you will tell the person that, okay, I am not feeling comfortable with you. Okay, I will leave. Evacuate, evacuate, evacuate. Someone with whom you're not feeling comfortable, some friendship you feel is not genuine, evacuate, evacuate, evacuate. I always tell my juniors, like this one, that in the flight attendant, she says, in a case of fire and water in the outside, please say evacuate, evacuate, evacuate. So that's what I feel. If you're feeling if you're suffocated in a relationship, say evacuate, evacuate, evacuate. That's it. Okay, so that's what. So life is short. Spend it with people who make you laugh and feel loved. It's as simple as that. There is a saying, right, that life is very simple, we only complicate it, and we end up saying life is so tough. Yeah, life is so complicated, I feel so sad, life is so tough. It's not tough, you make it tough. It's actually simple, but you made it tough. So it's okay if you made it tough. Now make it simple. Am I right or wrong? Am I making sense to you? Not making sense? God bless you. Today's topic of choice is nothing but tubercular meningitis, TBM. We're going to solve some amazing questions. I'm going to ask you some questions on CNS, and if you don't answer, then you see what will happen. Okay, yes, question number one. Okay, we'll talk about it. Yes, we'll talk about it. Let's talk little, then we'll chit chat again. The PG entrance question number one, which is the most commonest age group? Anyone? Which is छींक आ गई मुझे. Yeah, which is the most commonest age group of TBM? Can anyone put an answer in the comment section? Thank you. Hanji. Dr. Usama, could you please tell me which is the most common age group for TBM? TBM, tubercular meningitis, TBM, dimag ka TB, brain TB. What is the most common age group? Yes, the answer is 6 months. Yes, Kirti. 6 months to 4 years, right? 6 months to 4 years is the most commonest age group. Osama says 6 months to 10 years. Okay, buddy, but it's roughly 6 months to 4 years. Can we just study some integrated session? Can we make this 30 minutes of the class, make the strongest class on this planet? How can we make that? By integrated session. Can we have, and can you tell me any two important diseases where the most commonest age group is roughly 6 months to 4 years or 6 months to 5 years? You have five and a half seconds to answer. Your time starts now. Ooh, tell me. Osama, हाँ जी, आंसर बताओ. आंसर चाहिए, एग्जाम आ गया है, ठीक है? अब मत बोलना मैंने तो पढ़ा नहीं, पता नहीं कहाँ से पूछ रहे हैं, ये तो आता ही नहीं पेपर में. आता है तभी पूछ रहा हूँ. Yes. Perfect answer. The most commonest age group of severe acute malnutrition is roughly 6 months to 5 years. The most commonest age group of febrile seizure is 6 months to 5 years. ठीक है? Salmon seizure is very beautiful answer told by Osama, Kirti, Gunjan, Penaz, Priyanka Mishra, roll number 40, Ruhi, and so many million other people. Beautiful. God bless you. Perfect. Next question. Yeah, this is a good one. Tubercular meningitis. Tubercular meningitis is almost always associated with what? What do you think? Any random guesses? That TBM, if I have TBM, it is almost always associated with some other form of tuberculosis. What do you think, guys? Anyone? Yes, okay. Dr. Samosa, he says, Sir, aaj aapki BMW dekhi. In my hospital, my BMW is always in the center of the hospital. There's a G block outside there. It's just stuck there. And students, my juniors taking photo, like screenshot like that and sending me on WhatsApp. This is the only BMW in this hospital. I assume this is yours, sir. And I was like, yes, bro, this is mine. By your best wishes. The answer is pulmonary tuberculosis. Tubercular meningitis is almost always associated with pulmonary TB. I must have a pulmonary TB. I must have a primary focus. Have you heard of primary focus? Yes or no? I must have a primary focus. With all that lymphatic and the other spread, basically, it would have gone to my brain, causes tubercular meningitis. Are you understanding? Yes or no? Let's sit inside the topic. Let's sit inside the topic and look at the topic from 360-degree angle. Okay, you're inside the topic, tubercular meningitis. Tubercular, I can understand the patient is having TB, tubercular meningitis. No, the patient is having TB. Which TB? Brain TB, right? Tubercular meningitis, right? And this brain TB, matlab he would have got a pulmonary TB first, followed by TBM. Yes or no? Am I right? Am I right or right? Right? I think right. Right is the best answer. Perfect. Next question. Yeah, that's good question. Hanji, Dr. Osama, could you please answer which is the most common route of spread of tubercular meningitis? What do you think? Anyone? Any random guesses? What do you think, Osama, Akshay, Hanji? So, which is the most common route? Okay, I'll give you options. Hematogenous spread, lymphatic spread, by lymph nodes, by blood transfusions. How do you spread? The this one exactly. Hematogenous is a very beautiful answer told by Harika, Ashwasti, Gayatri, and Dr. VK. Perfect. Today I did thighs. Very good. Okay, my laptop is saying my battery is low, but my brain battery is very high. Okay. Perfect. मैं चार्जिंग पे लगा दूं एक सेकंड ठीक है perfect now no okay listen very carefully okay what are we talking here tubercular meningitis right TBM दिमाग का TB brain TB so 3-4 questions we covered question number 1 the most commonest age group is 6 months to 4 years question number 2 the most commonest route of spread is usually hematogenous age and it is almost always associated with pulmonary TB I would have got some TB lungs wala TB and after that as a complication I would have got क्या बोलते हैं उसको tubercular meningitis right I assume this much is clear to everyone yes my laptop is charged now next question the classifications that we have a classification of neurotuberculosis dimag ka TB have a classification we have intracranial tuberculosis and spinal tuberculosis do you remember okay it's very easy very easy neuro tuberculosis is divided right the parts of brain we have the brain and the spinal cord so we have one brain TB one spinal TB two TB you should remember okay so intracranial can you please give me some beautiful examples of brain TB do we have any kind of like tubercular meningitis of course is one of them but do we have any other examples of neuro tuberculosis yes exactly Dr. Bhatt we have good evening sir क्या हाल है सर बढ़िया ब्रो मैं ठीक हूँ आप कैसे हो क्या कर रहे हो खाना वाना हो गया खाना तो रात को खाओगे yes so we have various type of intracranial tuberculosis number 1 tubercular meningitis we have tubercular encephalopathy we have tuberculoma and tubercular brain abscess this text is very important for the theory students because TBM is a 5 marks as well as a 10 marks question in pediatrics for the final year MBBS students so you must remember that neurotuberculosis the examiner will directly not ask you TBM. He will ask you classify neurotuberculosis and tell the stages of TBM. Like that, the question will come. So neurotuberculosis, brain ka tuberculosis divided into intracranial and the spinal cord ka TB. So number 1 in the intracranial, very importantly, yes, in the intracranial we have tubercular meningitis, tubercular encephalopathy, tuberculoma, and tubercular brain abscess. Also in the spinal TB, very importantly, have you heard of pot spine? Yes or no? Have you heard of pot spine? Yes or yes. And I have a very beautiful question to ask you here. In a case of pot spine, TB spine, right? What will you see? There will be increase upper segment, lower segment ratio or decrease upper segment, lower segment ratio? Please put your answer in the comment section. Thank you. Exactly. Perfect. Yes, beautiful. So yes, there will be decrease upper segment, lower segment ratio in a case of pod spine. What will I call it? This decrease upper segment, lower segment ratio. Should I call it short limb dwarfism or should I call it short trunk dwarfism? Can anyone please tell me? Hanji, Osama, Mohammed Pasha, Swaraj, Suman, Gayatri. Yes, Munib. Eid Mubarak, आपको भी. Okay, this is known as short trunk dwarfism. That's very beautiful answer. And do we have any other examples of short trunk dwarfism? Quickly, in 5 seconds, can you just make me revise? I am a NEET PG student. I need to revise so much. So let's revise. So TB spine is one example of short trunk dwarfism. Yes. Can I say spondyloepiphyseal dysplasias? Okay. Can I say kyphoscoliosis? Yes or no? Am I making sense to you? नहीं सर, समझ में नहीं आ रहा, समझ में नहीं आ रहा, बहुत अच्छी बात है, डंडा चप्पल कहाँ है मेरी, अभी समझ में आएगा। तो स्पॉन्डाइलो एपिफाइजल डिस्प्लेसिया, काइफोस्कोलियोसिस, अच्छा और क्या था, एलेगिली सिंड्रोम, यस और नो, एलेगिली सिंड्रोम, yes. What else was which like a TB spine, right? These all are the examples of short trunk dwarfism. And the last question, which is the most common congenital heart in Allegheny syndrome? Can you quickly tell me which is the most common congenital heart in Allegheny syndrome? I really forgot. I don't remember. I have to revise so much. Can you please tell me? Anyone? हाँ जी जल्दी। और गलत आंसर या देखो क्या करना है मैंने पे। डॉक्टर अक्षय, ओसामा, प्रज्ञा, डॉक्टर वीके, गायत्री, सुमन, अदिति, मनीष यादव, who's deleting the message and typing and deleting, typing and deleting. Exactly. So butterfly shaped vertebra, very beautiful answer. My question is, which is the most common congenital heart in Allegheny syndrome? It is a question. I gave a super specialty exam, उसमें आया था ये। Bicuspid aortic wall, Osama is saying तुम्हें बंदूक से उड़ा देना चाहिए ऊपर सीधा heaven में. Yes, the answer is pulmonary stenosis. The most common congenital heart in Allegheny syndrome is pulmonary stenosis. Last question, do we have any other congenital heart with the most common, do we have any other syndrome with the most common congenital heart is pulmonary stenosis? Anyone? Dr. VK says, sir, I'm a FMG student. That's beautiful, buddy. This is important for FMGs also. Do we have any other syndrome where the most common congenital heart is pulmonary stenosis? Anyone? 5 seconds. जल्दी बताओ. Revision चल रही है ये, ठीक है? हाँ जी. So, okay, I will tell you. The most common congenital heart in Allegheny syndrome is pulmonary stenosis, and the most common congenital heart in Noonan syndrome. Noonan syndrome. Have you heard of Noonan syndrome? Exactly. Sukhbir is the right answer. Beautiful. The most so 2 question 1 answer. The most common congenital heart in Allegheny syndrome, where you see butterfly shaped vertebra, the most common congenital heart is pulmonary stenosis, and the most common congenital heart in Noonan syndrome is also pulmonary stenosis. Next question. Yes, what is the pathogenesis? So again, sit inside the topic, tubercular meningitis. Please look at the topic from 360-degree angle. Tubercular meningitis. I was having a pulmonary TB, then through that hematogenous spread, the TB pathogen went into my brain, causing tubercular meningitis. Right. As a 7th class student, if I can get a rough picture about it, that's what my brain, as a simple beautiful student, my brain understand this much. So as a pathogenesis, yes, there was a primary focus in the lung basically, which reaches the meninges, and by the hematogenous spread. Am I making sense to you? Is this 3 beautiful points correct? Yes or no? Is primary focus, is this line understandable? It reaches the meninges and by hematogenous spread leading to tubercular meningitis. Yes or no? Is it making sense to you? Yes. And then causing caseous necrosis and this and that. Beautiful high five words, very cute. Okay, and that's what I'm trying to say. By this hematogenous spread, that foci which reaches the meninges, okay, think, don't cramp, that foci from the primary focus reach into the meninges. Can we read this line together? These foci then rupture into the subarachnoid space, forming the basal exudates. Now this word is really important. As an MBBS student, if you want to get good marks, then you must tell the examiner that the primary foci which reaches the meninges, basically it ruptures into the subarachnoid space, forming the basal exudate. As you can see in the picture, the arrow mark, this is kind of a basal exudate. Wahan pe jaake, this foci basically they get ruptured. Okay, that's why I got seizures and all those clinical symptoms, right? So this line is important for us to understand that this foci, the primary foci which reaches the meninges through the hematogenous spread, basically they rupture into the subarachnoid space, forming the basal exudates. And you can also say they form this gelatinous exudates. I'm trying my best for every slide, showing pictures, so that you get a photographic memory. So ये यहाँ पे होते हैं, यहाँ मतलब at the base of the brain. Can you understand? This is the base of the brain. This is the MRI picture. This one MR. So there is the base of the brain. This यहाँ पे जम जाते हैं. यहाँ पे you have some basal exudates, and also over here very importantly, this exudates ban jate, they form a basal exudates or gelatinous exudates, right? Yeah. And can we read this beautiful line? These gelatinous exudates, they infiltrate the meningeal blood vessels. Basically, I have to get TBM. Okay, the patient has to get TBM. So number one, this foci will reach in the base of the brain and rupture, forming basal exudates, gelatinous exudates, and they basically infiltrate or घुस जाते हैं अंदर in the meningeal blood vessel, causing meningitis, right? So basically, can we understand this line that there will be inflammation? Of course, there will be inflammation, so there will be obstruction also, because where is the whole problem? The problem is there, no? Do you remember lateral ventricle, third ventricle, fourth ventricle, and then the base of the brain? In the 2 days back, we had a beautiful class on hydrocephalus. There we understood that we have this, in the brain, we have the lateral ventricle, then third ventricle, then fourth ventricle, then Lashka and Mengendi, then base of the brain, then बिल्कुल ऊपर जाके superior sagittal sinus में it drains the CSF. Do you remember that? Yes or no? I hope you remember. Yes, exactly. Beautiful. So so can I say that these all drama will cause of inflammation? Yes. Can I say it will cause obstruction to the CSF flow? Definitely yes. And also, can I say it can cause the infarction of the cerebral cortex? So yes, 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 yes. समझ में आया? Has everyone understood this much? 30 minutes are over. 20 minutes are left. क्लास तो पता ही नहीं चलता. क्लास समझ में आ रहा है? आर यू गाइस अंडरस्टैंडिंग? ऐसा लगता है जैसे हम, आई फील लाइक वी आर टॉकिंग, वी आर चिट चैटिंग, चिट चैट, चिट चैट, चिट चैट, चिट चैट. ओके, डॉक्टर साजिद सेज, सर व्हेन यू विल कम टू कश्मीर? कश्मीर, ओके. ठीक है, बताओ. अच्छा टाइम, व्हेन इज अ गुड टाइम टू कम टू कश्मीर? आई विल कम. This 31st of this month is my marriage anniversary, the first year of my me and my wife have finished first year of our marriage without killing each other. So we should celebrate that, and maybe we'll go to Dubai or somewhere Singapore. Let me know which place is good to visit. And then we have क्या कहते हैं, गुंजन. शी सेज, सर प्लीज पूरे सब्जेक्ट पढ़ा दो. पूरे पढ़ा दो. गायनी पढ़ोगी? ओ क्यूट. एनाटमी पढ़ोगी? विच इज द एनाटमिकल स्नफ बॉक्स? दिस इज द एनाटमिकल स्नफ बॉक्स. विच इज दिस मसल? दिस इज ब्रेकियोरेडियालिस. एनाट पीड्स पढ़ो. पीड्स पहले पढ़ेंगे, उसके बाद कुछ और पढ़ेंगे. हाँ जी, यस एग्जैक्टली. सो सुमन सेज कश्मीर टू कन्याकुमारी. ओके, गुंजन सेज गो टू मालदीव्स. ओके, रूही सेज दुबई में बहुत गर्मी है. यार दुबई में मैंने भी कहा था दुबई में गर्मी है, बट माई ट्रैवल एजेंट शी इज सेइंग, सारिका, दैट इन दुबई देर इज नो ओपन प्लेसेस टू विजिट. इट सीम्स शी वाज लाइक यू हैव टू गो फ्रॉम वन प्लेस इन कैब to the another place in cab, and inside only you have to roam, and she's like, it's very beautiful and this and that. What do you think, guys? Is Maldives good? Maldives में बीच नहीं होंगे सारा टाइम. Okay. Jaipur, I'm coming this month only. I'm coming to Jaipur. Maybe next week I'll come to Jaipur. Singapore is good, but my travel agent, she's saying Singapore is like Delhi only. Go to Dubai. Dubai is something different. Let me know. Okay. So can we just finish this topic? So I understood that basically the patient has, he had a primary focus, which basically reaches the meninges, and by the hematogenous spread, once it reaches the meninges, those foci, basically the primary foci, it ruptured into the subarachnoid space, forming the basal exudates, or I can say gelatinous exudates. They infiltrate in the meningeal vessels, causing inflammation, obstruction, and infarction, and meningitis. And that's what, very beautiful line. Can we therefore appreciate these basal exudates interfere with the normal CSF flow? Now, this is very beautiful. This exudates interferes with the normal CSF flow at the level of what? Now, this is a good question. Can you please tell me where is these exudates? It's a very nice question. These exudates, they interfere with the normal CSF flow at what level? At the lateral ventricle to third ventricle level, third ventricle to fourth ventricle level, fourth ventricle to the base of brain level. Which level basically these exudates interfere with the normal CSF? The answer is at the level of basal cisterns. Now, this is a star mark exam question. These exudates interfere with the normal CSF flow at the basal cisterns. Sir, I am a PG student. I have no idea what is this basal cistern. Never heard about it. Okay, bro, I'll show you the picture. So basal cistern, basically, dear, it is a compartment between the subarachnoid space. Can you know, right? The DAP, dura mater, arachnoid matter, and the pia mater. Yes or no? I think everyone knows about it. The layers basically of the skull, no? DAP, dura mater, arachnoid matter, and the pia mater. In the subarachnoid space, in the subarachnoid space, there only you have the basal cisterns. So basal cistern is a compartment between the subarachnoid space where the CSF flow. So यहाँ पे problem होगा, यहाँ पे at the level of the basal cisterns, the CSF will get stuck. The CSF will get stuck. And if I show this also, same another way of showing this is the basal cistern between the subarachnoid space, and also over here we have cistern. You know, like this part of the base of the brain basically. You have the what you called here basically the CSF gets stuck. The CSF gets stuck. And also, now this is the exam question. The very good question. Can you please tell me if I have an obstruction at the basal cistern? मतलब कौन से वाला level? ये brain का इस basal cistern level, right? It will lead to which type of hydrocephalus? Will I have non-communicating hydrocephalus or will I have communicating hydrocephalus? Now this question you have to answer because we have already done the hydrocephalus class, so I assume everyone should understand this. Hanji, what do you think? तो बातें चल रही हैं यहाँ पे विपुल कह रहा है मेरे घर आ जाओ. कहाँ कहाँ रहते तुम, तू बता. वेयर डू यू स्टे इन दिल्ली? वेयर डू यू स्टे, बताओ जरा. एग्जैक्टली. Okay, Dr. Sajid Iqbal says Kashmir will be the best place to celebrate your anniversary, sir. Yeah, actually, we also want to go to a very thanda place, but is it safe to visit there right now? Let me know. And the best answer for this one is it causes communicating. Now, this is important, okay? Communicating. If the if the problem, you know that we have the lateral ventricle, third ventricle, and fourth ventricle. If the problem is over here, then we have lateral ventricle, we have third ventricle and fourth ventricle. This is the foramen of Monro and this is the aqueductal canal of Sylvius basically. So if I have the obstruction of the CSF over here, lateral third or fourth basically, or I would say aqueductal canal of Sylvius का stenosis. So यहाँ पे which type of hydrocephalus is this one? This one, Baba, it's known as non-communicating hydrocephalus, or also known as obstructive hydrocephalus. Am I making sense to you? If the problem is there between the lateral and third or fourth ventricle, then that type of hydrocephalus is known as non-communicating or obstructive hydrocephalus. But just now I told you that in this case of tubercular meningitis, the patient is having a obstruction at the basal exudates, or I would say at the base of the brain, at the base, somewhere over here. Okay, 1 second. Like somewhere over the base of the brain, somewhere over at the base of the brain over here, no, not at the lateral to third. थोड़ा और नीचे problem है. So that basically will lead to communicating hydrocephalus. So that is why therefore can we appreciate that the type of hydrocephalus in general in a case of tubercular meningitis is communicating hydrocephalus. Very importantly, the same this one CSF flow, we have the lateral ventricle, then we have the third ventricle. In between, we have the interventricular foramen of Monro, then we have third and fourth ventricle, then we have aqueductal canal of Sylvius in between. After the fourth ventricle, through the foramen of Lushka and Magendie, our CSF goes into the subarachnoid space, then arachnoid villi. And where does the CSF get drained? It drains into the superior sagittal sinus. I quickly told this because 2 days back we had a 1 hour class of hydrocephalus. If you are a newcomer, please watch that class. It will be easy for you. That's it. This part is over. So now can we, this is a very good question. This is a very good question. Can I say that in communicating hydrocephalus, all the 4 ventricles will be enlarged, whereas in a case of non-communicating hydrocephalus, there is only dilatation of the lateral and third ventricle? Is this line true or is this line false? Can you make a sense over there? I told you lateral ventricle, then third ventricle and fourth ventricle. So in a case of aqueductals, you remember, right? This is the lateral ventricle, this is the third ventricle, this is the fourth ventricle. Lateral ventricle and third ventricle, we have interventricular foramen of Monro and aqueductal canal of Sylvius over here. So yes, most importantly, if I say that in a case of non-communicating hydrocephalus, when the obstruction is over here, then definitely there will be dilatation of the lateral ventricle and definitely there will be dilatation of the third ventricle. But there is no dilatation. There is no dilatation. Exactly. There is no dilatation of the fourth ventricle. Am I making sense to you? In an equirectal canal of sylvius stenosis, this one is a non-communicating hydrocephalus. Okay. Whereas, can I say this line that in communicating hydrocephalus, all four ventricles are enlarged? Because the problem is at the base of the brain, bro. Do you get it? Base of the brain में problem है. So when the problem is that basal exudates are stucking in the base of the brain, so lateral ventricle, third ventricle, fourth ventricle, everything will be totally enlarged. That's why communicating hydrocephalus, you will see all four ventricles are enlarged. And of course, the communicating hydrocephalus is also known as non-obstructive hydrocephalus. Whereas in non-communicating, the fourth ventricle will be normal. And also in a case of tubercular meningitis, communicating hydrocephalus is more commonly seen than the non-communicating. Is this line audible, visible, and sensible, and physiological clear? Please put a like button to this video, and also you can give a golden heart or a black heart or a blue heart. 10 more minutes, then this class is over. पहले मुझे इतना बता दो समझ में आया है या नहीं समझ में आया है. Did you get it? Please tell me yes or yes. Gunjan is so sweet. Gunjan is saying you can't type anything wrong. नहीं है. गुंजन कह रही है. ये कौन कह रहा है? मुझे मैरिलिन मोनरो याद आ गई. क्यूट. Yes, exactly. Okay, cool, perfect. Okay, now let's just finish it off, bro. Perfect. So can we have the stages of TBM? What do you think? How many stages of TBM are there? One, two, three, four. Hanji, exactly. Tell me fast, fast. How many stages of TBM are there? Do we have one stage, two stage, three stage, four stage? Exactly. That's what. Hmm. Hmm. Okay, Dr. Sajid Iqbal says that Kashmir is the most safest place. You come, I will be your guard shield that weekend. That's very sweet of you. That's very sweet of you. Dr. Sajid, you're there in our group, right? In the WhatsApp. I hope you're there. We have a small cute group. Okay, yes, exactly. So question number one, how many stages of TBM are there? There are total three stages of TBM. Dr. Osama Sheikh, could you please tell me how many stages of hepatic NCAF are there? How many stages of hepatic encephalopathy are there? Options are 1, 2, 3, 4. Hanji, 1. हाँ चला गया. हाँ हाँ. So stay 1, 2, 3, 4. How many stages of hepatic encaph are there? Exactly. What do you think? Gunjan, Swaraj, Manish, Gayatri, people who are replying has a very strong possibility to get a rank 1. Exactly. You have four stages of hepatic encephalopathy. Remember, we have three stages of TBM, but we have four stages of hepatic encephalopathy. What is the name of the stage of hepatic encephalopathy? Can we have a quick review? Can we have a quick revision? What is the name of the staging for hepatic encephalopathy? Hanji, anyone? Anyone? जल्दी बताओ. कुछ नहीं कहूँगा, मारूंगा नहीं अगर गलत आंसर भी दिया तो कोई बात नहीं. हाँ जी. स्वराज, उत्कर्ष, साहिल, गुंजन, सृजना, अश्वती, मनीष, अदिति, ओसामा. हाँ जी, ब्यूटीफुल. Panchal is very right. We have West Haven classification. Exactly. And what West Haven classification is the name of the classification for hepatic encephalopathy, number one. Number two, for the celiac disease. Celiac disease. Can you please tell me where I'm having gluten ka problem? Celiac disease. What is the name of the classification for celiac disease? Can you please tell me? I forgot. अच्छा ओसामा. ओसामा ने डिलीट किया बेटा. तू सुनते सुनते रह गया मुझसे ओसामा. तूने सही चीज़ डिलीट कर दी. हाँ जी. Exactly, exactly. Yeah. So celiac disease, yes, Osama is very, very right. The name of the classification for celiac disease is Marsh-Oberhuber classification. Marsh-Oberhuber classification. So Marsh-Oberhuber classification is the name of the classification for celiac disease, where we have the Marsh criteria, where we look for villous atrophy and intraepithelial leukocytes. IEL बढ़ जाते हैं. If you have read it, you might be knowing what I'm trying to say. So Marsh-Oberhuber classification is there in celiac disease, whereas West Haven classification is there in acute hepatic encephalopathy, and TBM has three stages. Can you please tell me? Yes, Gunjan, you're right. Can you please tell me stage 1, stage 2, stage 3 of TBM? Can you quickly tell me as a PG student, stage 1 ka TBM, if I'm having my primary focus has reached my brain and causing this meningeal inflammation and all that. So I'm having tubercular meningitis, okay? So stage 1, can you please tell me what are the points in stage 1? Do you see meningeal signs in stage 1? Now this is the PG question. Do you see meningeal signs in stage 1? Yes or no? What do you think? So anyone? Yes, the best answer for this question is in stage 2. In the stage 2 or stage 3 hepatic of the this one our what you call tubercular meningitis, you see meningeal signs. You don't see meningeal signs in a case of stage 1 TBM. Remember that. It's very important. Very, very important. Why, sir? Because dear in stage 1, no, it's only very this one. क्या है ये? Fever, right? ये क्या है? Teddy bear. Teddy bear. Teddy. I like teddy. So stage 1 TBM, the patient will have fever, headache, loss of appetite, photophobia, right? So these all stage 1 will be a kind of a prodromal symptom: fever, headache, loss of appetite, and photophobia. And stage 2, very important. Will you see meningeal signs in stage 2? The answer is bada bada yes. I'll give you one 5-star chocolate if you can tell me which sign has been elicited in this picture. What do you think, bro? Which sign is elicited? क्या है? कौन सा sign हो रहा है? It could be a very, very good recent NEET PG question. For the PG exam, they're asking a lot of amazing clinical questions. They will show you this sign and they will ask you which is the following sign seen in the picture. Anyone? Exactly. I don't know, Osama. Maybe they hug them tight in the night, no, because they don't have kind of a boyfriend, I guess. Anji, exactly. So, yeah, more beautifully, you should tell me, yes, sir, this one is a Kernig's sign. This one is a Kernig's sign, right? But both are Kernig's sign or what? I don't think so. Why? What is this one, dear? Hanji, exact. Now Osama is very right, very right. This one is Brzezinski sign. Yes or no? Am I making sense to you? So we have Kernig sign and Brzezinski sign. So the Kernig sign you might be knowing patient lie supine. Look at the photo and listen to me. Patient lie supine. I stand on the right side of the patient and I explain him the maneuver. This is you have to speak, okay, in a clinical exam. Anyone giving for next examiner is gonna judge you for that. The examiner is very much into okay in the treatment ABC airway breathing circulation. We always miss. Recently me and my HOD took an interview for the SRs in my hospital. How do you manage seizures? Then the girl told some answers that we will give midazolam or this and that. He's like, ABC nahi karoge, you will not do ABC. You will not directly you will give midazolam. You will not do ABC, this and that. Then my HOD was very particular about airway breathing circulation. This is like very important for him, right? And for important for anyone. So that's why same goes here also. In a Kernig sign, you tell the examiner that the patient lies supine. I stand on the right side of the patient. I explain the patient maneuver, what I'm going to do. And then very importantly, I can appreciate hip and knee. Can I say hip and knee flex to 90 degree? Yes or no? Hip and knee flex to 90 degree and I hyperextend the knee joint. Then I look at the patient's face. Patient will wince with pain. Patient with wince will pain and he will have stiffness in the hamstring muscle. Do you know the hamstring muscle, guys? Have you heard? Tell me the name of the hamstring muscle. Osama, name all 4 hamstring muscles. और नहीं बताया ना तेरे को मैं अभी ब्लॉक करता हूँ मोबाइल से, रुक जाओ आप देख, तो मुझे मैसेज करेगा सर प्लीज अनब्लॉक मी प्लीज प्लीज. हाँ जी, नेम hamstring muscles. Is this I'm asking out of syllabus? Is anatomy coming in the NEET PG exam? Oh, it's coming. Okay, then answer. Anji, name hamstring muscles. I also don't know. No, I never heard about them. You also did not hear. I also did not hear. No one heard about it. Exactly. Exact. Yes, Gunjan is right. The name of the hamstring muscles are. Have you heard of semitendinosus? Semitendinosus. Have you heard of semimembranosus? So semimembranosus, and what ischial part of adductor magnus, ischial part, you know, right? Adductor longus brevis magnus. So ischial part of adductor magnus and biceps femoris. Yes, exactly. Very well said. So semitendinosus, semimembranosus, and ischial part of adductor magnus is nothing but the name of the hamstring muscles. Okay. नाम क्यों पड़ा hamstring? कौन बताएगा? Exactly. सर ने लैटरल वेस्टिस करा है. कौन सा डियर? हाँ जी. सो क्या बोलते हैं वो ये नाम क्यों पड़ा? एनाटमी. हु इज द टॉपर इन एनाटमी? प्लीज टेल मी. यस और नो? यस, एग्जैक्टली. मनीष कह रहा है सर मैं मैम को बोल दूंगा आपने ब्लॉक किया. ओके. हाँ जी, नाम क्यों पढ़ा? कैन एनीवन प्लीज गिव मी अ क्विक आंसर. ये नाम कैसे पढ़ा था? हाउ डज दिस नेम केम? हैमस्ट्रिंग. व्हाट डू यू थिंक, ब्रो? Have you attended the first year anatomy lectures? Have you seen the not the lectures, the dissection table basically? Have you seen those hamstring muscles? How are they? Can you please tell me? Does anyone understand what I'm trying to connect you? Okay, in the last class we already discussed that Achilles tendon का नाम Achilles क्यों पड़ा था? We have spoken about it. So anyone? So basically, the hamstring muscle basically they are like that. Okay, their tendons are like this. Okay, so in the old age आदि मानव जो होते थे ना, जो वो सुअर जो pigs को hunt करते थे, in the old age when the people used to hunt for pigs and they used to carry them, ठीक है, once they used to for eating purpose they used to carry them. So once they used to carry them, they used to tie them through the legs. They used to tie them. Okay, जो वो उसको tie करते थे ना, तो जो उसका shape है वो it was like that. There the name is like this hamstring, क्योंकि यहाँ पे ऐसा देख रहे हो, this is narrow and this is thick. Okay, so that's how the name has been given, hamstring muscles. That you should know. Brad Pitt. Brad Pitt कहाँ से आ गया? ठीक है, done. That's it, over. Let's finish this class. So in the stage 1 TBM, the patient will have fever, headache, loss of appetite, and photophobia. In the stage 2, the patient will have meningeal signs like Kernig sign and Brzezinski sign. I assume you know what is Brzezinski sign. I hope you know that. And in stage 3, what happens? Yeah, also in the stage 2 with the meningeal signs, the patient can have seizures and the patient can have neurological deficit. Yes, Dr. Suman is very right. Hang pig on bamboo to carry. That's how the shape of the muscle is in our body, hamstring muscles. Very well said, Dr. Suman. Very beautiful. She is right. Yes, and in stage 3, what happens? Stage 3, jo bach jaye wo kar do. Whatever left. What is this? Can you tell me? Yeah, this is nothing but decorticate, and we have decerebrate. We have done this before. Abnormal flexion of the upper limb is decorticate, and all four limbs abnormal extension is decerebrate. Which one is more bad, decorticate or decerebrate? Decerebrate is more bad. And one more question I ask you, in the EVM, eyes, verbal, and motor. In the GCS, you know GCS, right? Glasgow Coma Scale. In that we have eyes, verbal, and motor. So how much points you will give to decorticate and how much points you will give to decerebrate? What do you think? And where is the level of lesion? Can you please tell me a little bit about it? Am I making sense? These are clinical questions. Hello, clinical question. Nothing theory in this, all clinical. हाँ जी, बताओ। सारे आंसर मैं बताऊँ? अच्छा, और आता ही है मेरी सब, मैं सारे मैं ही बताऊंगा आंसर। आई विल नॉट टेल ऑल द आंसर, यू विल टेल मी। यस एग्जैक्टली। रेड न्यूक्लियस इज द कट ऑफ पॉइंट फॉर द, उसके ऊपर का लेजन है तो डी कॉर्टिकल, उसके नीचे का है तो डी सेरिब्रेट, दैट इज 1 पॉइंट। एंड दिस वन, मेरा क्वेश्चन क्या है? विच एम यू विल गिव? You want to give M5, M4, M4, M3, what? Okay, M3, M2. Yeah, I think M3, M2 sounds better, no? I guess. Exactly. That's true. Okay, we have a happiness zone who says, sir, just now saw a TB patient in a ward who developed jaundice after starting ATT, bilirubin 3.6 and ATT stopped. Yes, exactly. This is a very beautiful question, Dr. Happiness. When I joined as SR in my hospital now, so I'm assistant professor there. When I joined as SR senior resident, this was the first question asked to me by my sir. He asked me, a patient of tubercular meningitis started on anti-tubercular therapy. On follow-up, the patient got features of jaundice. Now, what do you want to do? Do you want to stop isoniazid? Do you want to stop the all ATT? What do you want to do? So I hope you know the answer for this one. Perfect. Yes, exactly. Perfect. So yeah, exactly. So that's right. So Osama, what is this? Decortical decerebrate. Is it M3, M2, M1? What is that? So I think this M3 only, and decerebrate is M2, and I think M1 is like totally gone case. Okay, that's what. So perfect. Next question. Then the stage 3, the patient will have unequal pupil, and very importantly, and here I have got a question again. What is the normal newborn pupil? The normal pupils of a newborn, are they normally constricted or are they normally dilated? When, why? What do you think? Quickly. Hanji. Okay, we have Ashu Bhatti. He says, sir, I am Ashu, remember from TMU. Hello, Dr. Ashu. How are you doing, TMU, my batchmate, my this one? Yeah. So, it is very difficult to dilate a baby's pupil. Remember, it is difficult to dilate a baby's pupil. It is difficult. They have immature dilator muscle. Remember, newborn baby, they have a immature dilator muscle. The iris dilator muscle is immature in a case of newborn. So the answer is newborn pupil is always constricted because it is difficult to dilate a baby's pupil. Can you tell me why? Now it's a very good question. देखो पहला question तो हो गया. First question is over. The answer is a newborn pupil is usually constricted. It is difficult to dilate a baby's pupil because they have an immature iris dilator muscle. This is the first point. Second point, my question is that why a newborn baby you want to dilate the pupil? Do we have any condition? Do we have any connection where I want to dilate the baby's pupil? What is the answer for that? It's a very good question. Give me a genuine answer. Otherwise, मेरी चप्पल नीचे रखी है मेरी. हाँ जी, Dr. M. हाँ जी. नहीं, ma'am, dear Dr. Akshay, I'm not saying with what you dilate the pupil. I'm saying why. Why are we even talking of dilating a baby's pupil? Why are we dilating a baby's pupil? Do we have anything to do? Yes, exactly. Dr. Happiness, what is your real name? Tell me your name. You're answering good. In a case of ROP, dear, retinopathy or prematurity, yes or no? ROP screening. There, the ophthalmologist give us a call. Dr. Anand, please dilate the baby's pupil. We are coming. We are coming. And every half an hour we put like 1122 drops, and it is difficult to dilate the baby's pupil because they're normally constricted. And then often people comes and say this baby's pupil is not constricted, you have not put that Tropac P or tropicamide and all that, and I'm like, nahi baba, we put the Tropac P drops, nahi, the pupil is still constricted, it's not dilated. So ROP is clinically. When do you screen for ROP? Dr. Osama Sheikh, when do you screen for ROP? Yeah, retinopathy or prematurity, which is also known as retrolental fibroplasia. Retrolental fibroplasia. Two questions on ROP. 10 का दो, 10 का दो. हाँ जी. When do you screen for ROP? It's a PG question, ophtha question, pediatrics question, whatever question. हाँ जी. 20 within 28 is birth. Okay. Give me a beautiful answer. Anyone? Osama कहाँ है? Osama answer दे इसका. और गलत दे के दिखा. ये हाँ. Very beautiful. Very beautiful. Yeah. वेरी गुड डॉक्टर हैप्पीनेस परफेक्ट. हाँ जी, याद नहीं आ रहा. वेरी क्यूट आंसर. सो आर ओ पी स्क्रीनिंग मुझे याद करने दो. या ROP screening is done at 32 weeks of gestation or 4 weeks post natal age, whichever is later. ROP screening is done at 32 weeks of life or 4 weeks post-natal age, whichever is later. Okay, for example, ये हम कर चुके हैं, we have discussed it already, but still I'm telling again. But this is what we follow, okay? अब नया updates है, I don't know, but this is what we follow in our hospital every day. If the baby is 28 weeker, can you please tell me if the baby is 28 weeker, has born, at what weeks of life should I do his ROP screening? Can you please answer me? Anyone? Yes, exactly. Beautiful. Pragya, amazing. Yeah. So if the baby is 28 weeker, means 4 weeks post-natal age, na? 29, 30, 31, 32. So at 32 weeks of life, I will do the ROP screening. If the baby is 29 weeker, now when should I do it, dear? Can you please tell me? If the baby is 29 weeker, exactly. Okay, happiness zone. Sounds cute answer. Okay, perfect. If the baby is 29 weeker, अब कब करना है? So after 4 weeks post natal age means 30, 31, 32, 33. Now 33, right? So the answer was at 32 weeks or 4 weeks postnatal age, whichever is later. So here the later wala is 33. So in this case, the ROP screening is done at 33. Remember that. Done. How do you diagnose for TBM? Last 2 minutes and this class is over. Okay. How do you diagnose for TBM, guys? Can you please tell me? क्या करना चाहिए हमको? मैं नहीं बताऊंगा. How do you diagnose TBM? Tubercular meningitis. I have a focus which went to the brain. I got fissure. In stage 1 was prodromal symptoms. Stage 2 I got meningeal signs, focal deficits. Stage 3 I got decorticate and decerebrate and some unequal pupils I got. Exactly. Perfectly beautiful answer by Happiness, Nishtha, Radiance, Swaraj, Suman, Gunjan. Yes, beautiful. What is this picture showing? It could be a very basic first year PG anatomy question, MBBS question. ये क्या है? Exactly. lumbar puncture और cerebrospinal fluid is basically CSF का analysis करेंगे. क्या देखेंगे उसमें basically? What is the TBM picture? Can you please tell me how much will be the sugar, how much will be the proteins, and in a case of tubercular meningitis, will it be neutrophil predominant or lymphocytic predominant? What do you think? Hmm. Exactly. Exactly. Very quickly, you should remember, in a case of TBM, sugar कम, protein ज़्यादा, lymphocytic predominant. Quickly, sugar कम, protein ज़्यादा, lymphocytic predominant. Low sugar, high protein, and lymphocytic predominant is very important. And whenever I take a CSF sample, how do you demonstrate that? Like, can you comment? Like, if you're taking a CSF, will you look for something or anything like that? Hmm? Okay, we have Happiness Zone who says, Sir, my friend said ketamine is always used while doing LP in our hospital. Is it true? Dear Dr. Happiness, like it's not true actually. It all depends on hospital to hospital. Ketamine is little strong for sedation. Some in our hospital, frankly, we used to give midazolam, 0.1 mg per kg per dose. 0.1 से देते थे मिडाजोलाम बच्चा सो जाता था आराम से the baby used to sleep nicely after midazolam and we used to do the procedure. So in some hospital they give fentanyl, some they vecuronium, some they give ketamine, some says midazolam. It all depends on hospital to hospital, frankly speaking, Axel. In newborn sometimes they don't even sedate the newborn also. In some our many professors used to say don't sedate the newborn, just hold the newborn, do the procedure and finish it off, that because it has other respiratory depression and other CNS depression complications also. So it frankly depends on hospital to hospital. Okay. हाँ जी, okay dear. हाँ, exactly. Exactly. Aswathi Vijayan is right. Sir, a risk of respiratory depression will be there now with midazolam. Yes, dear. As my HOD said, my not HOD, my professor used to say that don't give midas, it will cause respiratory depression. And again, it depends from hospital to hospital. Okay. So in a case of this is a very important picture, guys. Take a screenshot if possible. This is what you called exactly. ठीक है. Okay. हाँ. So can you see that? Very importantly, we have the picture of bacterial meningitis, viral meningitis, viral encephalitis, TB meningitis, and brain abscess. I don't want you guys to cram every single line. No, it's not important. In general, I should remember in a case of tubercular meningitis, sugar come, प्रोटीन ज़्यादा, lymphocytic predominant, right? Sugar come, protein ज़्यादा, lymphocytic predominant is what I used to remember. Normal 40 to 80 is the sugar, 40 protein, 40 sugar. That's it. Actually, it all varies age-wise, newborn baby का अलग, adult का अलग. But I don't want you to take so much of headache. 40 normal is glucose, 40 normal is protein, and usually 2 to 4 cells. In 2 to 4 cells तक चलेगा. 2 to 4 cells is okay, that you should know. And very important, yeah, Pragya says yes, it's difficult to solve these questions. So that's why I will not go too much into this one. You'll get confused. So at least for TBM class, remember sugar come, protein ज़्यादा, lymphocytic predominant. And one very important thing I was asking you, वो मेरा बात change हो गई. I was saying that once you take the CSF sample now, what else do you look or see or this and that? So will you look for the color of CSF? Yes or no? Already Osama told a very beautiful answer. What is the normal color of CSF exactly? Yes. What do you think? What's the normal color of CSF? Transparent. There is no color, right? पानी की तरह होता है. It's transparent, right? Number one, जब हम CSF का sample लेते हैं ना, तो we always write the CSF, it was colorless. Number one. Number two, with the normal pressure. Very important. Have you ever done any CSF? You put the needle in the subarachnoid space and prak karke with a very flow jet the CSF has come. Have you ever done that? Yes or no? I have seen it. मतलब I was just putting tuck like this, पड़ाक करके like एकदम से ऐसा with a very high pressure the CSF came, which is very bad. It will certainly cause herniation. It will cause cranial or uncal herniation or cerebral herniation. So it shouldn't happen that way. It's not a good thing. Yes, exactly. So very beautifully, okay. Happiness say no, sir. I have not done, but want to do it ASAP. Do it ASAP, bro. Do it ASAP. It's very easy. Do it. It's very beautiful procedure. Procedure and all, you should be very good. See, if you want to earn 4 to 5 lakhs per month, if you really want to earn a good money, then ICU is something which is huge money it has. In medicine also, in pediatrics also, anyone of you wants to earn good money. So procedure should be very good. Putting a central line, putting an umbilical line, intubation, ventilation, ventilator, take a few months course of ventilator and all that, you'll be king. And all elective intubation, elective extubation, well, the whole, frankly speaking, the whole life of the patient is in your hand. If your hands are beautiful, you will give life to the patient. If your hand are confused, your knowledge is biased, then patient also will be biased and it will expire. So if you want to earn a good money with a sensible of amount of knowledge, ICU procedures you should be very, very good. And in MD time, of course, that is the only time you should be very good with intubation. Cannulation, very important in all private hospitals, not in private, government hospital. I was working in Lady Harding. Every JR sister is not allowed to touch the cannula. Only JR1, JR2, JR3. Like JR1, all JR1s, cannula, 50, 60, 70 cannulas per day, only JR1s. JR2, investigations. JR3, follow-up of the investigation. SR will see everything is going well or not. Assistant professor will see the patient. Are you understanding? It's a very beautiful hierarchy happening everywhere. So if you want to earn good money, then intubation, ventilation, this one, cannulation is very important. Procedures like CSF, putting a central line and all that. These all गिनती के 4-5 ही बाबा, और कुछ नहीं करके exactly. So we have medicine lover. He says, okay sir, I'm coming to learn from you. Okay, come. ठीक है. And yes, Gunjan has a very valid point. Gunjan says, बहुत depressing लगता है ICU में. That's what, dear. Now this is a very important point, Gunjan, you have said. You must do something which you like. This is really important. If someone who does not like ICU, it's a torture. It's a frank torture. Because frankly speaking, you will be 24/7 responsible for the baby, right? Obviously, बात है. Or the adult patient also. Same goes for medicine, same goes for surgical ICU, medicine ICU, neonatal ICU. ICU is ICU, right? So all procedure will be same, but the difference is one you will do in adults intubation, and in NICU you will do newborn intubation. It's as simple as that. But you must be very likable. You should love the branch. That's why I always tell everyone. What do I always tell everyone? Follow your passion. Okay, I'm sorry I'm deviating from the topic, but that's something which is more important right now to discuss. So follow your passion. Your passion is really important. If you love ICU, you should drown yourself in the ICU, right? That way. But for example, like if I talk about me, like I want to live a very happy life. I want to join dance classes. I've already joined dance classes. I'm very good in guitar. I go to gym, and I do multiple crazy things in life, and I study very nicely, and I love teaching. So I don't want to go to ICU because ICU demands dedication. ICU, if you go to ICU, your personal life will be extremely compromised. You will not have any personal life for sure. All patient will have your WhatsApp number. Patient only will see your WhatsApp DP and say, sir, nice DP, nice, you're going to marriage, nice dancer. Patient only will comment more than the real friends. So it's crazy. So that's what, so this is important. TBM picture, remember that. And very importantly, this also we had a, can you read this picture? We have this very beautiful, what you called picture. Can you please comment on this? This was my patients only, क्या बोलते हैं उसको, sample. Let me also read. CSF volume 1.5, appearance clear, color colorless. Sugar कितना है? Sugar is 51. Can you see that, guys? Please, can you have a quick look, dear? Sugar is 51. Okay. 40 was the range, no? Protein is 53. Okay, 40 was the range. Okay, neutrophil 35 and क्या बोलते हैं उसको, lymphocyte 65. And total count is 50. Can we see that? Yes or no? Hello, can we see that total count is 50 and normal it is written like 0 to 5. So can we have a quick understanding of this picture? Yes or no? Yeah, sugar thodi kam, sugar is 50, sugar is fine, little protein is higher, and we have 50 cells. Definitely there is some meningitis, definitely there is an abnormal picture. 0 to 5 is normal, 0 to 5 cells are normal. This baby has a 50 wala total count, which is definitely not normal, Now you have to see it is neutrophilic predominant or lymphocytic predominant. If it is lymphocytic predominant, of course you will think of more towards tubercular meningitis. Okay, if the invisible, okay, I'm sorry if it is invisible. Okay, cute. That's it. So can we have this very quick picture? Very important exam question. The appearance of cobweb formation is indication of what? Anyone? ABCD. Okay, I'm sorry if this not visible picture. मेरे को आ गई, लैपटॉप में देख रहा हूँ ना, मुझे नजर आ रही है. हाँ जी. So yes, the appearance of cobweb formation is indication of tubercular meningitis. I was telling you know, when the patient has a CSF, you will, this is an exam question. When the patient is, you take the CSF and you will see the color. It is colorless or it is kind of a transparent or translucent. Very, very, very important picture. What can you appreciate, dear? Can you see a cobweb? Can you see a cobweb picture, which is definitely cobweb CSF, which is a typical of tubercular meningitis? For this, I would like to thank Dr. Nitin, one of my very wonderful friend junior, and now he has finished his MD. One of the extremely intellectual person. He used to send me very good pictures of the patients and this one for learning purposes after taking consent. So yeah, that's this is nothing but a cobweb preparation seen in tubercular meningitis. Next question. हाँ ये part हो गया. And what else? What else? Treatment. Okay, let's finish the treatment. Yes, exactly. Yes, Dr. Happiness is right. Dr. Happiness, what's your name? You are answering good. What's your name? Where are you from? Which GR1, GR2, GR3? Who are you? Okay, he says to see this cobweb, we need to keep it for some hours, I guess, as far as I remember, second year classes. That's very true, dear. That's very true. Okay, okay, perfect. Hanji, treatment. Can you even please tell me what to do treatment? Of course, anti-tubercular therapy. कितने महीने के लिए देनी है? Can you please tell me for how many months should we do give ATT in this case, in the case of tubercular meningitis? कब तक देनी है? 6 months, 8 months, 10 months, 12 months? What do you think? नहीं 6 weeks, मार्शल 6 weeks में देंगे डियर. एक साल चलती है दवाई. You see, if I have a pulmonary TB, if I have a lungs वाला TB, then the treatment is given for 6 months. Yes or no? If I have a कहाँ चला गया? If I have a pulmonary TB, then the treatment goes for 6 months. We have the intensive phase and the continuation phase. Have you heard this, guys? Yes or no? हाँ जी. So if I have a lungs ka TB, you will give me medicine for 6 months. 2 months will be the intensive phase and 4 months will be the continuation phase. That is the first part. If I have extra pulmonary TB, then roughly see some book says 8 to 10 months, some book says 10 to 12 months. It all depends. So 10 से 12 महीने roughly मान के चलो, ठीक है? And of course we have HRZDS, isoniazid, rifampicin, streptomycin, ethambutol and pyrazinamide. And also my professor used to make me learn like 10 10 15 20 30, like that. 10 10 15 20 30. Nowadays, frankly speaking, like all TB ka dawai has a fixed dose regimen. It's a already fixed dose. Weight wise, if you see the latest TB guidelines, everything has totally changed now. Before it was category 1, category 2, category 3, defaulter, relapse. Then they made it category 1, category 2. Now it's like weight, according to the weight. Fixed dose regimen is there. We have the dots center. We send the patient there, free medicines, and what you call fixed dose regimen. Weight के हिसाब से, according to weight they give the medication, and that's it. Okay. 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 Akshay says nice DP laptop. Nice DP laptop. Acha, this I have this Lord Buddha. I love Lord Buddha. Very nice. Yes, ये हो गया. अच्छा, very beautiful answer. Very beautiful answer. So very very important in the treatment. Other than this one, yeah. Do we give steroids? Do we give steroids in this case? Can you please tell me? Do we give steroids in this case in a case of extra pulmonary tuberculosis? Is steroid indicated? Should we give steroids? No, steroids को देने क्या ही फायदा? So the answer is बड़ा बड़ा yes, 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 yes. Steroids. This was this was my third year MD exam question. In my third year MD, when I finished my MD, we had examiners from various beautiful places, and they were asking me, why do you give steroids in a case of TBM? The answer was, of course, to reduce the inflammation, and basically it helps in relieving the intracranial pressure, and even in vasculitis also it will reduce that. So it reduces the inflammation, reduces the intracranial pressure. Basically, it helps in revealing that, resolving that, the role of steroids. And Dexa देते हैं हम usually 0.1 mg per kg per dose 6 hourly. 0.1 according to OP Guy 9th edition, we give 0.1 mg per kg per dose 6 hourly, followed by tablet prednisolone. You start off with injection, Dexa is injection, okay, and then you shift to goli tablet, okay. 0.1 mg per kg per dose 6 hourly, followed by tablet prednisolone for 6 weeks, basically for 6 weeks, and then you taper it to the next 6 weeks, right? That's you should know. Yeah, exactly. Did you understand this one, guys? Is everyone? We're gonna end the class. The class is over now. ठीक है? Now only chit chat. और सुनाओ क्या चल रहा है लाइफ में? सब ठीक है? Nice. ठीक है? Perfect, perfect. And treatment of choice, naturally, can the patient develop hydrocephalus in a case of what you called TBM? Definitely, na? Because stage 2 TBM, CSF problem, CSF obstruction, communicating hydrocephalus and all that, and even non-communicating also, whatever that CSF pathway gets stuck. So basically ventriculo Peritoneal shunt is something, kind of, I should remember that. And basically, last question. This question for USMLE and MRCP-CH students. Anyone applying for MRCP-CH and USMLE has this question. A 14-year-old girl, very beautiful question. A 14-year-old girl who is on oral contraceptive pills. A 14-year-old girl on oral contraceptive pills came to doctor. She came to doctor. He's giving her prophylactic antibiotics for contact with a proven case of meningitis. Listen very carefully. 14-year-old girl who is on oral contraceptive pills came to doctor with the OCPs. Doctor is giving her prophylactic antibiotics for contact with a proven case of meningitis. Now she is having bleeding per week since 1 week, and 1 month later her UPT came positive. Now can you please tell me what is the problem? Anyone? What is the problem here? The girl, she was on OCPs, now she's pregnant. Oh my god, that's crazy, right? She will do a medical legal case against the doctor कि भाई doctor is very bad and ये कैसे हो गया गलती से? She's taking OCPs now. So the answer for this beautiful question for MRCP-CH and USMLE is exactly, we have which is the drug responsible? The biggest answer already told by beautiful people, rifampicin. Rifampicin, yes, Dr. Happiness is right. Dr. Happiness, what's your name? You will not tell. You will not tell. You are like, we have an ID known as the lost. वो भी कसम खा रखे हो, नाम भी बताएगा अपना. हाँ जी, ठीक है. So हाँ जी, rifampicin is an enzyme inducer which cause failure of the oral contraceptive pills. Yeah, that's the beautiful answer. Rifampicin interferes with the oral contraceptive pills. So that's the basic logic behind it. That finishes today's class. Thank you so much for this wonderful participation. और क्या कहते हैं, yes, so I hope, did you understand the whole class? Yes or no? Yes or no? समझ में आया या नहीं आया या ऊपर से गया? हाँ जी. ब्यूटीफुल नेम, किसका ब्यूटीफुल नेम डियर? कौन से गर्ल का बता रही हो ब्यूटीफुल नेम? हाँ जी, that's right. So I hope you had an amazing time, and before leaving we always have a motivating quote, and today we'll have a quick song. Okay, very quick song. कौन सा सुनाए? एक अच्छा सा कोई पुराना गाना सुनाते हैं. तो मुझे गाने बहुत लिमिटेड आते हैं, ठीक है, डोंट माइंड. कुछ तुम सोचो, कुछ हम सोचें, फिर खुशी का मौसम आए. तन्हा तन्हा कौन जिया है, रह के तन्हा दिल घबराए. आ जाओ मिलके रिश्ता ये जोड़े, शर्त बदल के सपनों को मोड़े. इससे पहले कि ये दुनिया हमें आजमाए. ओ कुछ तुम सोचो, कुछ हम सोचें, फिर खुशी का मौसम आए. तन्हा तन्हा कौन जिया है, रह के तन्हा दिल घबराए. I hope you like the voice. एंड इस गाने को सब्सक्राइब, अगर मुझे वोट करना चाहते हैं तो प्लीज़ मेरा आईडी है डॉक्टर आनंद, और प्लीज़ इसको लाइक करें, सब्सक्राइब करें, और मुझे इंडियन आइडल जिताएं. ऐसे करते ना, वो आता नहीं, सोनी भी नहीं आते इंडियन आइडल, वैसे वो बोलते थे करके, आई रिमेंबर. Thank you so much everyone for this wonderful participation. I hope you guys had a beautiful time. And before leaving, we always have a motivating quote, and this motivating quote is amazing. We need everything permanent in a temporary life. We need everything permanent in a temporary life. Life is so temporary, you know. Yesterday COVID came. Today some other drama came. Tomorrow some other drama will come. So like, you know, the life itself is so temporary, you know, right? When the COVID came, when the COVID had come, basically so many people wiped out, you know that, right? Like लाखों लोग, people died and this and that. अमीर से अमीर, गरीब से गरीब, सब चले गए, you know. I hope you know that, right? We lost so many lives and so many people. So life is so temporary, you know. People who were very rich, they also went. Everyone went. The money remained there only, and everyone went. That's so funny. That's so crazy, right? So that's what we need, everything permanent in a temporary life. So what is the moral of the story? The moral of the story is enjoy. The moral of the story is live. Don't just exist. Don't exist. Don't exist. Live. Don't exist. Live your life. Okay, enjoy. Be proud, be strong, be amazing. Look at the mirror and look at in your eyes and tell you are the best, and you are actually the best. You just have to believe it. That's it, nothing else. Okay, That's what. Thank you so much, everyone, for this wonderful participation. Have a wonderful night ahead. Tomorrow, every day now, we're gonna have the class, okay? 5:15 p.m. and 8:30 p.m. Please make sure you guys are free, okay? And if I feel like I'll start taking midnight classes also at 11 p.m. But 5:15 p.m. and 8:30 p.m. make sure you guys are free. 5:30 p.m. to our special class in the Unacademy, and 8:30 p.m. every day on the YouTube channel. This one, Let's Crack NEET PG. So these two times, I want you guys to be free. Let's talk about it. Let's talk about life. Let's talk about pediatrics and finish the whole thing. Thank you so much, everyone, for this wonderful participation. I hope you guys are safe and be amazing. ओसामा, ठीक है, नया गाना सीखता हूँ मैं, सीख रहा हूँ नया गाना, और ओपन हाउस अभी नहीं है, अभी आएगा तो बताएंगे डियर, ठीक है? ओके, बाय बाय, टेक